Healthcare topics you need and wellness tips you deserve, all straight from the doctors themselves. Maayong Adlaw Cebuan, Kriya Padilla from CDN Digital together with the hospital at Maayo, and this is Maayong Adlaw Doc. In the last episode of Maayong Adlaw Doc, we talked about osteoporosis and arthritis together with Dr. Fernandez. Okay, and of course, you can always check out our previous episodes at the CDN Digital's Facebook page, website, or YouTube channel. Now we're back for another interesting topic, but before we go there, let's watch this video about the hospital at Maayo's surgery services. The hospital at Maayo's surgery services, together with its medical team and facilities, are capable of dealing with various surgical procedures from simple outpatient cases to the most complex operations. The hospital at Maayo is a home to diverse facilities to help patients receive healthcare solutions suited to their condition. The hospital at Maayo is not only a modern, clean and safe hospital designed to provide hassle-free medical care for its patient, but they also provide only the best healthcare experience in Cebu, paired with world-class hospitality, accommodations, and amenities. And now for another informative episode for today, we will be talking about scoliosis and bone fracture. So let's learn more about this topic from our guest doctor today. Our guest doctor for today graduated Doctor of Medicine in 2005 from the Cebu Institute of Medicine. Aside from being a diplomate of the Philippine Board of Orthopedics, she is a fellow of the Philippine Orthopedic Association and had a fellowship training abroad in Austria, Hong Kong, Japan, and Switzerland. She is also an international member of Arthroscopy Association of North America. Let's welcome our guest doctor for today, Dr. Pia Karina Quiñones. Maayong Adlaw, Doc! Welcome to the show!
Maayong Adlaw.
Sige, we're going to talk about bones gihapon. Last week, we actually spoke about kaning mga arthritis. Today, let's talk about scoliosis. What's gina siyang scoliosis, Doc? I've heard about that so many times, and kaboko mo hiwi ang likod. But what exactly is that?
So scoliosis is an abnormal sideway curvature of the spine. Supposedly, when you look at the person, the spine is straight. But for scoliosis, it's right or leftward curvature of the spine.
Does it hurt?
It doesn't for those with mild scoliosis. We measure the angle of the spine. So we classify it as mild, moderate, or severe depending on the angle of the spine. If, for example, it's less than 10 or less than 20 degrees, it's not really painful. But for those with severe curves like 30 or 40 degrees, they might have pulmonary or lung problems na because maipit siya. Kana siya, shortness of breath, and of course, they feel pain because of the abnormal curvature.
What causes scoliosis, Doc, and who usually gets this?
So, scoliosis can be idiopathic or no known cause. Wala lang yun. Idiopathic no known cause. Wala lang yun siya unfortunately, mo na gid na ihang curve.
So, unsa like inborn? Not necessarily.
When the child grows, ni abnormal lang yun. Pwede siya family or genetic factor. Or for those nga mga congenital like underdeveloped ilang spine while in the mother's womb, or those with katong mga cerebral palsy, kato siya mga congenital or mga neuromuscular disorders associated with scoliosis. But commonly, katong idiopathic nga no known cause. Oo.
Okay. So, how does one deal with scoliosis then? Like, mga activities?
So, for those with a milder form of scoliosis, like less than 10 or less than 20 degrees, they can just do any sports activities and it will not impede with their function. So, they can be just like a normal person.
Pero Doc, will it worsen?
Okay. So, for those patients diagnosed at a younger age, like usually adolescent 10 to 15, they have to be closely monitored for worsening of the curve. Because when the patient is young, before their growth plates close, before they stop growing, there's a chance that their curves can worsen. However, if they reach around 18 to 21 years old, they stop growing naman, so it's less likely that their curves will worsen. So example, you have a curve of 15 degrees diagnosed at 10 years old, and then yearly monitoring with x-rays, your curve doesn't progress, or sometimes the doctor will prescribe a brace just to stop the worsening of the curve. When you reach 18 to 21, whatever curve that you have, it's less likely to worsen. And then after 21 years old, you don't need a brace anymore because it will not worsen naman. It will not progress. So for those patients also diagnosed with scoliosis at a later age, like 25, and then if you think you can wear a brace to stop the curve from progressing, there's no need na because you stop growing naman. So for those patients, I just advise strengthening of the muscles, proper back care while at work, or proper posture, just to give more support to the spine, because whatever curve that you have, that's it.
You mentioned kanina, for people with mild, 10 to 15 degrees. How about for people with mas curved yun sila?
Mas curve pa. So
what activities?
For those with severe curves, example, more than 40, so that's considered surgical already. So for those patients who need surgery, screws will be drilled through the vertebra, and then they will be attached to rods. And this will correct the curvature, the sideway curvature of the spine to make it a little more straight. So it will not compress the lung and the heart anymore. And then they will have a straighter spine, although not really perfectly straight spine. Siguro mga correction to like mga 20 degrees, 15 degrees. Yeah.
Are they supposed to wear that for life?
Yes, they can, but for some, it can be removed because the bones will fuse, or they will be healed together after a few years. So they can be removed. Yes.
I'll go back to
but it's
question.
Another surgery na.
Okay. I'll go back to my question earlier na, does it hurt? You mentioned that it does not hurt if mild lang.
Yes.
So pasabot, the more curved it is, the more painful it's going to be.
The more painful, and then the more severe the curve is, you will have na other problems sa lung, sa heart, because diba sideways. So it will compress the, example, right or the left lung, or the heart also. So cough, shortness of breath, cardiac problems.
What if, Doc, you have scoliosis, mild lang, and it doesn't hurt? Is it okay if I don't touch it? I don't do anything with it?
Yes, but for those patients diagnosed at a younger age, they have to be monitored for...
Kay mo grow pa man lagi
yes,
sila.
yes.
Pero like if you've stopped growing already, like you're 25 years old, pero gamay lang ang imuha, is it okay? You just leave it?
Yeah. It's like you're a normal person. Yes.
But are there activities na bawal yun nimo?
If your scoliosis is mild, you're not restricted to to any sports activities. Yes.
So pwede
No
kita mo
restriction.
basketball,
Yes.
mo swim,
soccer, jiu-jitsu.
Oh wow.
Yeah.
That's good. That's good news, no? Okay. Pero I remember when I was younger, I had friends na ingon sila scoliotic daw sila. Bata pa mi ato high school. And then they mentioned na there was a particular bed that they're supposed to use. Unsa na, Doc? Are you familiar with that?
Maybe for back support, like not too soft and not too hard. Those cushions, those mattresses with an orthopedic support, or kana siya. So they can use that. So they will not have any back pain or something.
What happens if it's too soft? Yeah.
If it's too soft, your posture changes when you sleep. If the bed is too soft, there's a tendency that your spine will also like change. So in the morning, you will wake up with a stiff neck or with a back pain.
Too soft.
Yes.
Same as when it's too hard, no?
Yes.
Or they don't get comfortable if it's too hard.
Yes.
How about water beds? Is it advisable for people with scoliosis?
Yes.
Water beds?
It is okay. It is okay. Yeah.
Pero
you can use water bed.
Follow siya sa
curvature of the,
okay
of the spine. Yes.
Okay. So, Doc, sige, walk us through the procedure if pero mauna man tayo mong gisulti earlier, di ba, na butangan og bolts sa to?
Yeah, for those
screw?
with severe scoliosis.
That's how we correct scoliosis.
Yes.
Through surgery, no?
Yes.
So, what are the things now one has to remember if they are scoliotic? Things that they need to do?
Mostly for the parents, they have to check, mostly adolescent children or growing children, they have to check for any unevenness of the shoulder, or most parents, they can relate it to heavier bags, but that's why she has an uneven shoulder or an uneven gait. The way she walks is different because of the bag that she carries, heavy bag that she carries to school.
Is that true? Can it
contribute? It doesn't cause scoliosis, but maybe it's a sign that you have an uneven shoulder. It's a sign your daughter has or your son has. Yeah, you have to check, and then if you are in doubt, go to your pediatrician or an orthopedic surgeon to have X-rays taken, and then we can check for any curve of the spine. So that's how we diagnose man through X-rays. Yes.
All right. Now, if we deal with heart or lungs, there are things na bawal, things na good for the heart also. Are there things also na like that for the spine? What are the food that we need to eat for the spine to keep it healthy, the exercises to keep our spine healthy?
So it's mostly exercises and good posture for the spine. So we have to have a good muscle tone, core and back
good
muscle.
Posture ko na. Sige, everybody. Okay,
core and back muscle strengthening and a good posture. So nowadays we have a lot of gadgets, diba? Tablet, laptop, we tend to stoop and then magsigig duko, and then cellphone. So it's not really good for this. Not only for scoliotic patients, no, but for those people who have a normal spine, because kana siya. In the long run, there's a degenerative process. It's another problem na.
Yeah, what happens, Doc, if mauna, you keep on, what you practice is bad posture, good.
Yes.
What eventually can happen to you?
So at first, there will be muscle imbalance. Then you will feel muscle stiffness, back pain or neck pain. And then eventually, the cartilages of your spine, because it's a joint, remember it's a joint, it's like the knee and the hip. It's a joint. So there's a cartilage which can undergo wear and tear or degeneration. So that means, di ba, wear and tear, muhilis, manipis. So unfortunately, the cartilage cannot grow into its original smooth and young form. So it cannot regenerate, it cannot form into new cartilage cells. So degeneration means irreversible na siya. So drying of the cartilage, and then kana na siya, dili na kay pain, or sometimes nerve impingement for the spine. So another disease na sana siya. Yes.
All because of bad posture?
All because of bad posture. Yes.
Okay. So it's important, yun nga, while still young, we teach the kids proper posture.
Yes.
And I don't think it's too late for us. Sige na, go. Straighten your backs.
Strengthening exercises, core also is very important.
Core?
Abdomen, lower extremity.
Okay.
Yes.
Sige, may pa si Doc ay super guwapa. Okay. Sige, Doc. So that's it for our scoliosis. Thank you very much for enlightening us with that. Let's proceed. Another bone problem. Fracture di ay. what is a bone fracture? Kanang mga nabalian ka, nahulog ka. Is that what we consider bone
Yeah,
fracture?
so it's a break in the bone. Actually, it's caused by pressure that's more pressure that the bone can handle. That's why mana mo break. Caused by fall, accidents. Yes. Sometimes, kanang gitawag na stress fracture. So,
what's that?
Yeah, it's our repeated, you have repeated stress or trauma to the bone, and then, yeah, your bone cannot...
Like that part of your body keeps on getting hit?
Yes. For example, you can get it while running.
Yes.
Yeah, you can.
Sa imuhang mabalik po siya?
Pwede.
Wow.
But that's stress fracture.
Yes.
Also, if you have abnormal vitamin D levels, abnormal metabolism.
Kaya ang density sa bone dili na maayo.
Yes.
So it gets broken easily or
yes,
gets weak.
Yes. But mostly accidents. It's caused by accidents.
Are there different kinds of bone fractures, Doc?
We can classify it as a simple fracture or a complex fracture, meaning the bone is broken into several pieces, not just two. Yes. There are a lot of classifications actually.
Okay.
And then we also have a shape like oblique, transverse, and then we also have like the site, which specific bone or which area of the bone is fractured. So there are different classifications.
Curious lang ko, Doc. What is the most common na causes of bone fracture na maabot sa imuha?
Usually motorcycle accident.
So asa na part da yon? Lahi-lahi?
Lahi-lahi. Many.
But the cause
thigh,
is...
leg.
But the cause is motorcycle
yes.
accidents.
Sometimes nasa ni classification of closed and open fracture. Closed fracture is kanang walay samad, meaning no abrasions, no laceration, no wound, but the bone is broken. And then there are also those with open wounds na magawas ang bukog kanang mga inganan na caused by usually motorcycle accidents, or ang uban pedestrians hit by a car or a motorcycle.
I see. What happens if we don't address the fracture?
For open fractures, katong mga naay wound, it's a high risk for infection.
Yes.
Infection, and then the bone has pwede siya dili mag-heal, meaning no union, non-union of the bone. So if the bone doesn't heal, dili magsumpay imuhang bone. So dili na siya ka-support sa imuhang extremity. So you might not be able to walk or use that extremity if it's not fixed.
Yes. Pero katong closed, Doc, is there a chance ng bone mo connect again?
Yes, but it has to connect properly aligned. It has to be, not necessarily you have to put back all the pieces together, but the bone has to be aligned, so you can have a straight extremity, and then you can recover your function with a proper alignment. So we can do it by casting or surgery.
Pero pwede po i-cast?
Yeah, pwede ra i-cast ra. If you can achieve for closed fractures, katong walay samad, and then dili rasad kaayo swollen, kay if we cast it, we will put fiberglass tape man around the area. If grabe kayo ang swelling, maipit naman siya. So it can pwede siya matuok ang blood supply, pwede siya mo gangrene, So if it's safe to cast, okay lang. As long as we can achieve the proper alignment, the length, yes.
Pero if that happened to somebody who is an elderly, is there still a chance nga mobalik gihapon ang bones?
Yes, however, sa elderly, consideration nato is osteoporosis. So, compared to the younger ones, ilahang healing is slow, and then ang alignment sad basin dili na kaayo ma-support with a cast ba. But we can do something about it. We can do surgery also, or we can add like medications, anti-osteoporotic medications after casting or after the surgery. So they're murag mas strengthen ilahang bone.
Right. Earlier, Doc, we mentioned na a lot of these bone fractures are caused by accidents. Here in the Philippines, Manggod, it's very common na if somebody gets in an accident, tabangan dayon pabarubon na. And eventually, na-worsen na noon ang case kay nasamot na, nagka-balik-balik nagsamot ba. Okay, what can you say about that? What are we supposed to do if somebody is in a met an accident, lying on the floor? What are the things that we need to do? Okay, basin na ay fracture ba?
Yes, yes. So for fractures, you have to immobilize, meaning don't move. Fix or temporary stabilize it with a splint. Usually they use carton or piece of wood tied to the extremity, so it can be stabilized. So meaning wala kaayo movement. Kay the more movement, the more painful man. And then they have to.
But how do we know nung nga nga part na mauna ang bali?
Okay.
Oo. So how do we do first aid for people na inana?
Katong splinting, like carton or wood nga i-attach sa extremity para di siya mulihok. Kaya the moment ma-move siya, it's more painful man. And then risky sad ang neck. Example, you found a person lying and then you don't know if he has a neck fracture, a cervical spine fracture or something. So don't move the neck.
Mo po na question, how do you know nga you're not supposed to move the neck? Especially if unconscious.
Aka na siya, you don't have to move the neck yun. You have to, like, kailangan yun ka like bed or board.
In short, wait for the ambulance.
Yes. And also, no, for example, wala lang ang spine, no? Example, extremity, arm or leg. Ang number one kontra sa mga doctor is katang hilot-hilot. Kaya it can worsen the soft tissue condition around the fracture. Example, forearm fracture, then or wrist fracture. Then sige, pahilot lang sa, nagdili lang sa atuon ang doktor. And then they didn't know na that patient has a fracture. Siging hilot-hilot, ni swell na hinuon. Okay, manipulation, and then syempre ang fracture is hait man na siya, di ba? So the more you manipulate, the more sad masamad ang soft tissue, ang kanang mga muscle, ang skin, ang fat nga nag-surround sa fracture. Pwede siya mo swell, pwede na pud siya pud gihapon ma-infection pud.
Ano bitong hilot, Doc? Like, for example, especially sa mga bata ba, they fall, then napiang kuno, ipahilot. Unsa man na ilang pasabot nga napiang yun? Nganong ihilot?
I'm not sure also what they mean by that, but I associate the word piang with fracture or kana, but it's not advisable to have it manipulated by a non-medical na person. Kay wala man siya confirmation if what's the injury man. So mas maayo to bring the person yun immediately to the doctor.
And the best way to tell no kung naagi fracture is through X-ray.
Proper diagnosis, X-ray. Yes.
Okay. Now, kung a person has a fracture, how long does it usually take to heal?
Okay. Usually, it will take about 6 weeks to 3 months ang healing time.
Depending.
So there's a process. The bone has to undergo that certain process, and then you can't just shorten the process by taking medications. No, you have to wait for the process to take place.
Yes.
The bone will start to form around. The bone will start to harden around 6 weeks. 6 weeks after the injury, and then it will continue until mga 3 months, sometimes 6 months if delayed yun ang healing. Kana siya.
What should we do to achieve really a very good full recovery?
Full recovery. Number one, you have to immediately after getting injured, you have to see a doctor, and then you have to be treated right away. Casting or if surgery ba, and then if you are treated man good, you have a very good chance of recovery. Then after that, you just follow what the doctor recommends. Like for example, casting. If you are casted, they will remove the cast with siguro 6 weeks until 2 months. And after cast removal, you can do physical therapy, move your joints, move your extremity, start strengthening, because the physical therapist will train your affected limb. No? For a while, it has been immobilized, your muscles atrophy or your muscles are thinned out. And then after cast removal, your muscles will start to develop na. Kana siya.
So the keywords there is follow your doctor's
and then
recommendation.
have yourself treated immediately.
Wow, yun.
So the sooner, the better. For some, they go to the doctor 2 months after the injury. And then, of course, the fracture or the bone will try to heal man gyud. The bone will form, but you have to guide it into its proper alignment. Because if, example mo, wait kag 2 months, hiwi lang gyapon imong bone, so hiwi ra gid siya gyapon, di na siya mo straight yun.
Thank you very much, Doc. Please tell our viewers how to properly take care of our bones before we end the show.
Yes. So for parents also, monitor your children we have talked about scoliosis earlier, no, for unevenness of the shoulder, unevenness of the way they walk. So you have to check, and then if you have doubts or if you feel that there's really a need to go to the doctor or it's not really normal, your child has really a deformity, have them checked. And then for those involved in falls or accidents, if you have swelling on your extremity, and then the pain doesn't go away after a few hours, and then the extremity continues to swell or there's deformity, have yourself treated immediately. You have to see a doctor, and then have yourself treated properly.
Yes.
No self-medication or treatment by somebody.
Or no pahilot, because it might get worse. You might do more harm than good.
Yes, usually, yes.
Sige, Doc.
Kana lang.
Thank you very much, Doc, for gracing the show, and we hope to have you again one of these
you.
days. Thank you, Doc Pia.
Thank you.
And that's it for our episode for today. Now, thank you very much, everyone, for watching our episode. And of course, please do share this to your friends and family so they may also learn from the discussions today. Now, from their promise of Maayo, which in Cebuano means be well, discover a new healthcare experience in Cebu at the hospital at Maayo. And of course, if you want to know more about the hospital at Maayo, please head over to their Facebook page. That's the Hospital at Maayo, or their website, or better yet, call these numbers below. Again, thank you very much for joining us today. I'm Priya Padilla Ruleda from CDN Digital. See you again next time.